Welcome back. So today we're going to show you how to do hip internal and external rotation banded capsular mobilization. What that's going to improve is your position in flexion with external rotation, okay? Or flexion, or as a functional movement, it's going to improve your squat, right? So oftentimes you'll see that people end up squatting and they turn their feet out like this, or they end up bringing their knees in like this, and both of those are a compensatory movement strategy to compensate for a lack of internal or external rotation in the hip, more notably in the hip capsule. And that's what this mobilization is going to help you with. So let's get into it. What we're going to do is get a band, a monster band here, pull it high up on your hip, all the way up to the hip crease, and the closer you get to the joint crease, the more leverage the band will have, and that's a good thing in this scenario, okay? Then we're gonna get we'll get into this kind of quadruped position and walk away and get some good tension on there. All right, now we're gonna turn my body perpendicular to the band, right? So that the band is pulling my hip laterally. Let's get in that position. And now, and now we're gonna get in this quadruped position. I want my weight on my left leg, so I'm gonna go ahead and stretch out my right leg. Scoot over a little bit so I can do a better demonstration here. I'm gonna prop up on my right leg, or just on my toe on my right leg, and then my left leg, all the weight is driving my femur through the back of my kind of glute, my butt here. And first movement I'm gonna do is I'm gonna bias external rotation, okay? So I'm gonna swing my leg around into external rotation, lock that in. Sometimes you can just keep it there, or if you want, you can grab a kettlebell or a dumbbell or something, help you lock it in like that. Good. And now I'm just gonna keep my spine straight, make sure that your butt's kind of turned on a little bit, your rib cage is pulled towards your spine so that you have a neutral spine there. And then we're gonna shift everything to the left, okay? So that's gonna bias that left side of my hip capsule, all right? So everything shifts to the left, and I keep it spine straight. And now, sometimes people have an issue here and they still don't feel anything. So what we'll say is, drop the opposite side of your pelvis down. So I'm gonna just make sure that I drop the right side of my pelvis, and now I can definitely feel that I've wound up that lateral part of my hip. If you drop the right side of your pelvis and you start to feel pinching in there, then you just need to back off a little bit back off some of that flexion a little bit, okay? So you just come forward some, and then try and shift over a little bit, or drop that right side of the pelvis. Good. Now we wound up that lateral side, and now we can drop down to our elbows to get more of that posterior part of the capsule. Good. And you can toy around with shifting back a little bit. So now I feel I'm in a great position where I feel that posterior lateral part of the joint capsule. And now I can oscillate back and forth, kind of little half crescent moons, and you'll really start to feel that the more time you spend on this, the more comfortable you become, and the nervous system relaxes a little bit, and you'll get more of that musculature around the hip will let go, and you'll feel it sink more into that joint capsule. And that's the sweet spot. That's where you want to be. Spend some time there, 2 or 3 minutes, 5 minutes if you got it, oscillating, contracting, relaxing. Big breath. Hold, get tight. 1, 2, 3, 4. Relax. Let it sink in a little bit more. Maybe I take up the tension, either sitting back, sitting to the side, or I wind up more of that external rotation, okay? You can oscillate your body back and forth, whichever way, whatever you feel like is limiting you the most. And now we switch over and we do internal rotation, okay? So we're gonna swing the leg, same setup, exactly the same setup, except you're swinging this leg out, okay? So that's internal rotation of the femur. Again, if you need something to block, no shame in that. Block yourself, okay? So now I've got internal rotation, take my right leg out, spine straight, get some tension in my abs. So now I'm just gonna shift over again, shifting so that my knee comes underneath my belly button. Whoo, man, I feel that already. It's smoking right here, kind of on that, almost down to that linea aspera. Oh man, but now I'm not gonna cry. Okay. So we biased internal rotation. Now we biased that lateral part of the capsule where the knee's underneath us. Now we're gonna go into flexion a little bit. I can come down to my elbows. It's a little bit more relaxed position. Lets me relax my body. You always want to have that Zen face and be in a position where you tell your nervous system you're still under control. You know, it sucks, but I'm under control. If I need to, I can drop that right hip. I can even lift my leg up if I need to on that right side. That gives me all the tension on that left hip, and now I can just oscillate. I can contract, relax again. Big breath in. 1, 2, 3, 4, and relax. Man, that feels fantastic. Oscillate into rotation, but the floor is yours. Experiment with that. Use that informed freestyle with the information that you're given. Always test, retest. So now get back into that squat position. Feet straight, knees out, and my left side feels amazing. Right side feels a little bit more restricted, but as you can see, my left side, I can keep my foot straight. My knee can drive it way out, which creates stability in the foot, the knee, the hip, the lumbar spine. Now I'm in an upright position, an athletic position. I can do what I want, and I don't have to worry about injuring myself. So that's going to improve your performance, get rid of your pain, and make you more human. We'll see you guys next time.